Hello and welcome to Edukemy's YouTube channel and editorial discussion for 10th May 2022. My name is Harsh Singh, and in this video we shall discuss two editorials from today's newspapers. One from today's The Hindu, which is titled Why the COVID-19 Numbers Matter, and the second is from today's Live Mint, which is titled What They Don't Tell You About India's Official Death Toll. Both editorials are important to understand the issue of civil registration system in the country and the public health management. Now, both the items are covered under India's governance and the health issues of GS paper 2. If you like this initiative, share some love through likes, shares, and subscribes. Let's discuss. We all are aware that in 2022, just a few days back, the civil registration system report of the year 2020 was out. It spoke of the total number of deaths in the country in the year 2020 as 81 lakh and excess death of around 5 lakh. If you see the average of excess death as compared to the last 2 years, the excess death were around 8 lakh in numbers. And you would be surprised to know that WHO also agrees with this data of the year 2020. They agree with this data. However, what they do not agree with is government's estimation of total COVID deaths. While the government of India says that total number of COVID deaths in the country in the last 2 years, 2020-21, have been 5,24,000. WHO has released a report saying that the excess death is 47 lakh in the country, and this is 9 times the number, making India the country with the highest COVID death toll. And this is where the disagreement lies. In fact, it is not only a disagreement, the 9 times different is staggering high. And the alarming difference has raised questions, skepticism, doubt on India's reporting strategy. This is irreconcilable, and that is why we need to understand how civil registration system reports. What is the issue behind this? Let us understand this. See, the civil registration system itself does not do all the registrations. If people come to report deaths, they will be given the death certificates. However, the Registrar General of India, the one who reports all these deaths, they themselves use a system called as sample registration system. They go out in the public and they estimate the death count by understanding what is happening at places. So this is a large scale survey and randomized, going to rural areas, urban areas, poorer areas, rich areas, and this is how they would be able to gain an understanding about the average death toll. And through this SRS data, sample registration system data, is fed to the civil registration system, and this is how the tally or the numbers are calculated in the country. This is what the government does. They calculate the ratio of registered deaths. Not all deaths are registered. See, when the CRS records its death, these are registered deaths, but when they get the data from the sample registration systems, that means survey across the country, so a proportion of this will be the registered deaths. I hope you understand what I am speaking of. This will be called as the registration of deaths, which will be issued certificates. Now let us understand what is the surprise element in the registration of deaths. Is it possible to have more than 100% registration of deaths? It is not possible. However, it is happening in the country where civil registration system is reporting more than 100% of registered deaths. It means that the sample registration survey is not doing its job properly, right? So the randomized updated data that we get, it is less than the actual data. Right. So on one hand, what happens is civil registration system is reporting more of deaths. However, in this kind of reporting, who they exclude is the poor people, the children, and the women. On the other hand, when the sample registration survey happens, going to randomized places and conducting these kind of surveys and then extrapolating this, who are being excluded? There are some people who are being excluded. They are non-poor and adult men. So both the systems are flawed. Civil registration system, direct registration and getting the certificate, they are excluding some people, and the sample registration survey, both of them are flawed at some places. Now, instead of pointing at WHO and giving long speeches against what WHO is using, we must improve on our own health calculation. Right now, National Family Health Survey, this is more accurate data, and it says that in the last 2 years, 2019 to 21, when they noted that 71% of the deaths have been reported. 71% of the deaths in India have been registered in the country, and this figure was very low in the poorer states or the poorer population. So Bihar, only 36% of registration of deaths, Jharkhand 40%, and Uttar Pradesh 47%. So Registrar General, they themselves agree that the credibility of the civil registration system and sample registration systems both are not as strong. So why the government need to defend all this? See, indicators like mortality, health pattern, cause of death, all this must be noted, which is not being done as of now. And this only disease and death data, only the data that we have will be able to help us improve the health outcomes for the people and not defending the numbers. Now, the other editorial says that we must focus more. This is about reporting of the death. What about public health system? They say that the system is designed for underreporting. For example, if when we report a death in the hospital, the cause of death is often ignored. Malaria, typhoid, cholera, rabies, snake bite, all is ignored. So why are we specifically pointing out the COVID deaths? It's only because of this pandemic, na? That's good. So we must be self-critical and we must improve this method to understand what has been the cause of death in the country. Now, tuberculosis has been an exception. Why? Because tuberculosis is a disease of wider spread in the nation, and WHO has supervised this program at the national level, state level, and the district and sub-district levels. There has been an elaborate surveillance mechanism, and there is a TB division in the ministry, in departments of various states, and that's why tuberculosis deaths are reported better than the other deaths. This is what must happen for other kind of deaths as well. So health management will have two parts. One part is about surveillance and prevention of the disease or issue. So for example, the places like primary health centers, right, or the health and wellness centers, HWCs, these are designated for surveillance, for prevention of disease, going out and understanding what is the issue. This is the surveillance. This is public health's first part. And the second is the one that deals with the doctors, where we go and get admitted in hospitals for diagnostics and treatment. Now second part is for disease handling and management. The first part is for disease prevention, public health. And public health can be determined if we have good data on health issues. For example, simple example is the sudden lockdown that we had throughout the nation, the shortage of oxygen supplies, hospital beds, vaccination issues, excess death, all could have been managed better than, this is the COVID fallout, no, all of these issues all could have been managed better had we known some real time data on these kind of issues, had we known which are the places where COVID is spreading fast. For example, people moving because of migration from Delhi to Kerala because they came back home during the times of COVID lockdown, or from Delhi to Uttar Pradesh and Bihar in those rural areas. Had we known this, we would not have had these kind of health shocks. So knowing the movement of people, data about their health issues, and this must not only be applicable for COVID, this can be applicable for other diseases in times to come, other pandemics. If we have a public health division which does extensive survey to calculate, to collect data, analyze data, and to produce those kind of stats which are cues, which are hints to the doctors, the hints to the doctors will be such that they'll be able to control and signal if a pandemic is about to break out or not. And this is how we will be able to have health shocks being absorbed by the country. This is important. Health is as important as business and as important as education, right? So the numbers of dead that we are counting right now should not be treated as ex post facto data. Ex post facto data means just using the data for the heck of calculation because it has already passed. No, we should use this as a hint to prevent infections in the future, handling malnutrition amongst people, and helping of preparation of wisdom-oriented statistics, so that these issues can be prevented. Now, see, we've discussed three editorials related to public health systems and COVID mismanagement: the side of the government, the side of WHO, and this talks about the fundamental underlying cause of civil registration systems. And I hope that the issue is now clear with all of you. A quick question. Mention five needs for having a robust public health management system in India. A simple question, but then exercise your brain and type down in the comment section. If you like this initiative, share some love, and if you got some questions, put it down in the comment section and we will ensure to get back to you. Thank you for participation.